Hey y'all, and welcome back to UpLiftFit Nutrition Radio. I'm your host, Lacey Dunn, registered dietitian, here to spread the scientific knowledge in the worlds of fitness and nutrition. Today we're going to talk about mental health, specifically anxiety and depression from a natural medicine perspective. So let's get ready and let's get started. Hey y'all, and welcome back to UpLiftFit Nutrition Radio. Today I have Dr. Janelle Sinclair, all the way from New Zealand. She's a biochemist, natural medicine practitioner, and author, and she has such a wealth of wisdom and knowledge, and I'm stoked to have her on. If you have not followed her on Instagram, she discusses a lot about anxiety, depression, mental health, and nutrition, and all these different related causes and causative factors. So I'm just stoked to have you on. Thank you so much for coming on my podcast, taking your time. I know it's hard for finding a time because you're all the way over there in New Zealand, but can you tell my listeners a little bit about who you are and what you do?
Yeah, great. Thank you so much, Lacey. It's awesome to be here. Lacey, I'm 42 years old. I'm married and I have two beautiful kids, and they're 5 and 7 years old. Just to give you a little bit about me, that I'm a mum and a working woman as well. And as you've said, Lacey, I'm from New Zealand, and I'm sure people can hear that in my pretty broad accent. But I've got a PhD in biochemistry. I got that from Switzerland, even though I was born and raised in New Zealand, and I've been working in the natural medicine industry for over 14 years. For the last 5 years, I've been consulting with clients specifically in the area of mental health, and more recently, really just this year, I've been trying to get that word out there to a lot more people. So I've launched a YouTube channel and my Instagram account as well. So I really love talking about the biological or the biochemical causes of depression and anxiety. And I think that there's not just one cause for mental unwellness. There's so many causes, and they all interact. And so we've got to consider the psychological, spiritual, social, and the biological causes. But I think that the true biological causes of depression and anxiety often overlooked. So when I say that, I'm not just talking about low serotonin, which has been the theory of depression for decades really. But when I say the biological imbalances, what I'm talking about is nutritional deficiencies, hormonal imbalances, gut dysbiosis, so gut health issues, adverse reactions to food, toxins, and even some genetic weaknesses that can lead to depression, anxiety.
Yeah, so it's a lot more in-depth than a lot of people know. Now, do you mind describing the serotonin, so low serotonin syndrome?
Yeah, well, it's just a theory that serotonin is a neurotransmitter. It's a inhibitory neurotransmitter, so it's calming. They also say it's a happy neurotransmitter, but when there's not enough serotonin, that's the theory, that when you've got low levels of serotonin, you can have increased anxiety and low mood. Yeah.
Okay, so then that presents the reason for serotonin reuptake inhibitors, SSRIs, and why people are prescribed those a lot. For my listeners, they all know that I am all about, fixing the root problem and not just giving a Band-Aid on an issue. So I'm very excited to talk about all these potential causative factors. And let's dive into the next question. So what are the common nutrition deficiencies that can be contributing causes to anxiety and depression?
Well, we've got to remember the basic things like iron and vitamin B12 and folate. And this should be tested for every single person with low mood and anxiety. And I believe that these tests should be done before an antidepressant is prescribed. And just to show you how powerful just these three simple things are, I had a client with panic attacks and really bad anxiety. And so she came to see me, and I sent her to the doctor to get tested. And she ended up having huge panic attacks and ended up at the hospital. And she could have been so easily put on antipsychotic medication, but because we had ordered those tests really early, they went on to her charts, her records, and saw that her iron levels were really, really low, like malnourishment level. And it just makes me smile because she ended up getting an injection of an iron, and she ended up having vitamin D as well because those levels were so low, and the anxiety and panic attacks just resolved. So I just think it's just incredible just that, a couple of minerals can be that powerful. There's other common nutritional deficiencies as well, like omega-3, vitamin D, as I said, zinc, magnesium, I think even chromium and iodine, so kind of indirectly through blood sugars and the thyroid as well.
Oh, yes, and we're going to dive into the thyroid too, but I very much see, sadly, a lot of people have vitamin D deficiency. And I also see the problem with conventional doctors are still stuck on, the whole aiming for 30 millimoles and above, and it really should be 50 and above because people still can show signs of depression if they're sitting at 30. That's not optimal in regards to functional medicine type of vitamin D levels. Would you agree?
Yeah, that's right. And the Vitamin D Council has really great information on that. I've also got a YouTube video all about vitamin D, and nice. I've got a report that people can download, and it helps them interpret their levels, their vitamin D test results, and then it gives you kind of a guideline on what level of vitamin D supplementation that you're going to need. So if any of the listeners are interested in that, go and check the YouTube channel out and the vitamin D report. But the problem is even in New Zealand, vitamin D blood tests aren't funded, so people have to pay for it themselves. In New Zealand, we have a situation which our medicine medical care is funded, but vitamin D is not funded. And the studies show that I think it's about 48% of New Zealanders are deficient in vitamin D. Wow. It's about the same in America, and it's even worse in America. The Hispanics have 69% of Hispanics are deficient, and it's over 80. I wrote down the statistics somewhere here. 82% of people of colour have actually got vitamin D deficiencies, and this is not, as you say, subclinical. Also, a mild deficiency. This is by medical standards a deficiency. So it is a massive problem, and most medical doctors just think vitamin D is for osteoporosis and bone health. But these studies, it's pretty novel, these studies, but there is even a case study of someone that had psychosis because their vitamin D levels were so low. So it is really important. And other studies show that the lower your vitamin D levels, the more fatigue that you're going to have. And if you supplement with vitamin D, and here's the catch, a lot of these people in this study were on supplementation of vitamin D, but it was only like 1,000 international units a day, so pretty mere minimum levels, and they still had low vitamin D. So they had to get on the 5,000 type international units a day, kind of higher dosing, to actually resolve those levels, those deficiencies, and get their energy levels up higher. So,
That's crazy. And as something I do want to mention for my listeners, if you're taking a vitamin D supplement, do try and take a vitamin D supplement with K2 in it for better absorption.
Yeah.
Better use.
Yep. Great advice.
Okay.
Yeah, great advice, Lacey.
So, how do these deficiencies affect the brain and result in mental unwellness?
Well, as we said about this low serotonin theory of depression, a lot of these deficiencies can affect serotonin production or dopamine, which is another neurotransmitter that's a reward-giving pleasure-giving, motivation-giving neurotransmitter. So we kind of forget that there's the way that the body makes these neurotransmitters. It actually needs vitamins and minerals to do that. So if we have a deficiency, the body can't do that. Also, like with omega-3, it's involved with inflammation. So if you have an omega-3 deficiency, you'll have an inflammation of the body and including the brain. So a lot more cutting edge theory of depression is inflammation of the brain. So yeah, so omega-3 is one of those things that we can do to dampen down that inflammation. But you've also got to remember that our brain is made up of lots of fat. So I think it's about 60% fat. And so if we have an omega-3 deficiency, the structure of those nerve cells in the brain and the ability for the nerve cells to be able to communicate with each other is affected as well. The deficiencies can sort of just lead to low energy of our cells. You know, if we have poor mitochondrial health, the mitochondria are basically the battery packs of every cell in the body. And if the batteries are low and running on empty, that's going to sometimes, my theory is that it can cause adrenaline surges. I've seen it with some clients that have really low mitochondrial function. And it was my theory that when the body got overrun and the body's like, I can't give you any more energy, all I can do is give you adrenaline, and then the panic attacks would come in and anxiety. So that's my little theory about another cause of anxiety.
For sure. I see a lot of anxiety in patients who have adrenal dysfunction for me, and a lot of thyroid, Hashimoto's type of thing. But hands down, you know, the first thing I like to say is, if you are struggling with depression or anxiety, get your blood work done. Don't just hop on a pill. Get your blood work done. Test for these. Yeah. So why do we have these deficiencies?
So if you think about omega-3 for a start, it's an essential fatty acid. So it's essential that we get it from our diet. And where do we get omega-3 from? One, the highest, the food that's got the most omega-3 in it is fish. And so firstly, sometimes we have these deficiencies just because of our dietary choices. So maybe people don't like fish, or maybe it's too expensive. But number one, I always just ask people, how many, fish servings do you have a week? I try to discourage tuna. We've got to be eating the smaller fish so that it doesn't have all the pesticides and heavy metals in them. So smaller fish and nice fatty fish like salmon. But another reason that our food's low in omega-3 is just our agricultural practices, unfortunately. When you read we call it grain-fed beef. Yay, grain-fed beef, you should eat this. Because it's fed grain, the omega-3 content of that meat is going to be lower. Whereas if they're just eating plain old grass, which they do here in New Zealand, luckily, the omega-3 content of the meat is going to be higher. But the same goes with chickens and the eggs. If they're eating grains, the eggs are going to be higher in omega-6 and lower in omega-3. So unfortunately, we can't control all of those things, but you can choose to eat grass-fed meat. Another reason we're having these deficiencies, obviously with vitamin D, it's the sunlight vitamin. So people are staying indoors, people are wearing sunscreen. Over here in New Zealand, we don't have much of an ozone layer, and so, we get very burnt very quickly. And so everyone is told that they have to be wearing sunscreen and have to be covering up. But with that comes the risk of a vitamin D deficiency, and lots of us work inside as well. So, we need to get out there. And the Vitamin D Council suggests that you expose half of your body to sunlight every single day, and you need to be out there for half the time it would take you to burn. So, I like their recommendations because it's based on your skin color, because I would burn in 5 or 8 minutes in New Zealand, whereas someone that's very dark might take an hour. So it just shows the different needs of different people as well. Another deficiency I love to talk about is a zinc deficiency when it comes to mental health. With zinc, it can be due to the poor soil or not getting enough zinc-rich foods. But another thing is just our genetic vulnerabilities. So there's something that runs in families called cryptopyrroles or pyroluria. Have you ever heard of that, Lacey?
No, I haven't.
Yes, it's been known in the functional medicine, also molecular medicine areas for, I don't know, since the 50s, I think it was. And they find that it runs in families, this pyroluria, and when people are under stress, the pyrrole molecules increase in the body in people that have this condition. And these pyrrole molecules steal zinc and they steal vitamin B6 from the body. And so you end up being zinc deficient and vitamin B6 deficient, and we need these nutrients to create our neurotransmitters. So what they find with people with the pyrrole disorder is that you have anxiety running in the family, you have depression, you have bipolar addictions, alcoholism, autism, dyslexia as well. So anyone with mental health that runs in the family, especially with people that don't do well with stress, I'm like, have a look at zinc and pyroluria. So sometimes these deficiencies aren't about just what we're eating, but our just biological individualism, I suppose, and just some of us just lose these nutrients or need them in greater amounts than other people.
Yeah, that's very interesting. And for my listeners as well, because we have a lot of women on this podcast, birth control depletes zinc and B6. So make sure that if you're taking birth control, that you are repleting those vitamins and minerals. That way we are not leading to that deficiency. Yeah,
and with the pill, it also increases copper. And copper and zinc are kind of imbalance in the body. And so with that condition, the pyroluria, often people have low zinc and high copper. So you have to try to get the copper down as well. So, and for some people, they get on the oral contraceptive and they're okay for a while. And, it's just this insidious kind of slow increase in their copper levels over time. And so initially they might be all right, but it could be the high copper after 6 months, a year, 5 years that they've been on the oral contraceptive. So usually the estrogen-based oral contraceptives, it can be that high copper that's leading to increased anxiety. And so when someone stops the oral contraceptive, their anxiety might not stop because of these deficiencies and too much copper. That's the cause, really. Yeah.
Interesting. So do you suggest like a hair mineral analysis for that, or blood? Case by case?
Hair mineral analysis. Yeah, hair mineral analysis, zinc and copper are a little bit difficult to read. Okay. So it depends on your practitioner if they're really good at looking for the hidden signals with hair mineral. I use something called the oligoscan, which it's really, really cutting edge stuff, but it's a hand scanner, well, not a hand scanner, but a spectrometer that measures minerals in the skin of the hand. So you can do it on the spot in the clinic. So that's one that I've used for about 2 years that I really quite like. Yeah. So
that
it's an alternative.
So fancy.
But yeah. On the spot you get minerals and heavy metal levels done. So it's patients love it because you can prescribe on the spot in clinic. So, but I do like copper blood tests are reasonable and a good option. Yeah.
Well, you heard our listeners. Okay, next question. How do hormones affect our mood and anxiety levels?
Well, as you know, Lacey, there's lots of different hormones.
Yes,
and so we could be discussing thyroid, or we could be talking about adrenal dysfunction, but progesterone and estrogen as well. And in my latest Instagram posts, I've been talking about progesterone and PMS and PMDD, which is a very severe form of PMS. So do you mind if we talk about progesterone today?
Yeah, that'd be great.
All right, because you know that we could talk about thyroid for the next hour.
We definitely could talk about anything.
Hour. Yeah, exactly. So I don't know what the listener's background will be, but most people will be familiar with estrogen, the female hormone. But a lot of people, if they haven't learnt, sort of not in the natural medicine field anyway, won't have heard much about progesterone. So estrogen and progesterone sort of work in balance, and they both help to regulate the menstrual cycle, and progesterone is very key for pregnancy. But what people need to realize is that after ovulation, progesterone levels should be really high. But what happens with premenstrual syndrome, or PMDD, premenstrual dysphoric disorder, is that progesterone levels aren't as high as they should be. So we get a progesterone deficiency. And because progesterone, one of its roles, or one of the things that it does, is it increases GABA activity in the brain, and GABA is an inhibitory neurotransmitter, so it's very calming. So if you're not having enough progesterone, you're not getting enough GABA and not getting enough calming neurotransmitters in the brain. So that can give rise to anxiety, and that's going to happen, a week before your period. It might happen 1 or 2 days, which is reasonably normal for women. But if it's 3 or 5 or 10 or 14 days, people can have very high anxiety because of this progesterone deficiency.
So in people who have a low progesterone, do you suggest oral progesterone or like a progesterone cream to start?
Yeah, well, I'd start with chasteberry, because especially if you're young, it's really good to get your own body creating the progesterone. But secondly, if people are a little bit older, or chasteberry doesn't work for them, definitely progesterone would be a good option. As you say, you can get it in a capsule, and you can get it in a cream. The reason I like cream is because it doesn't go through your liver, so it's applied directly to the skin, and it can go into the bloodstream. And so it's a lower dose. It's about 10 times less a dose than the progesterone capsule. And the cream also, you can you can change the dose a lot easier, to put a half a teaspoon on versus a whole teaspoon. And so, rather than taking a capsule or half a capsule, it's a lot easier to change the dose depending on your need of the day or the time of the month. So, yeah.
Well, thank you. As my listeners know, I'm a big fan of chasteberry or Vitex for people who have like amenorrhea. So good to know that I'm doing the right thing, and you agree with me. Next question. As we know, 90% of serotonin is created in the gut. So how often do you see gut disorders being the root cause of anxiety and depression?
Well, I really have to just base this on, my clients and the people that have come to me. So it's going to be a really crude number, but I'm sort of estimating maybe a quarter of my clients at a minimum, maybe a little bit more, just because those are just based on the ones that did kind of comprehensive testing, in which I could just judge what the issues were. But usually it won't just be a gut issue. It'll be combined with some mineral deficiencies or vitamin deficiencies as well. So, that will give the listeners an idea of how important it is.
Yes, gut health is very important and it's very much overlooked. So if you have, any issue, don't be afraid to get into the nitty gritty and look into things. So next thing is kind of tough. So if stress causes gut issues, but gut issues can cause stress, how do you go about finding the root, or do you have a practical tips for those suffering with both?
Yeah, well, I'll give you some practical tips. The thing is that it just comes down that you have to work on both areas. You have to work at the same time, really. You have to work on managing the stress, and then you have to work on healing the gut. I think this is great because, for some people they find it very difficult to handle or not handle, but manage those stress. And sometimes some stresses in your life are just outside of your control. There's ways that we can manage them, and people are doing their best. So, work with a psychologist to learn healthy ways to manage your stress and create good boundaries. I think people are working too much, so we need to create boundaries about not working too much and having enough rest and restoration in your life, having good sleep. I'm just recording a video on caffeine and anxiety, so it's in my brain at the moment. So stop drinking coffee, because if you've got anxiety, and I don't think you should be drinking coffee, because that raises the stress hormones in the body. So that's a very simple thing to do. And if people are saying, I can't go without my coffee, then they probably need to be thinking about their adrenal glands and giving some support for their adrenal function as well, so they're not so dependent on coffee for that for that increase in their energy levels. Diaphragm breathing is another must. I think that's kind of obvious to a lot of people, but doing diaphragm breathing every day. But when it comes to the gut, there's lots of things that you can do to help improve gut health. So drinking broths, collagen or gelatin powder. So, people that do smoothies could just do a tablespoon of gelatin powder in their smoothie. Sorry, not a gelatin, but a collagen that doesn't solidify. So you can get non-solidifying collagen that you can just put in your smoothie. For kids, we can make little marshmallows made out of gelatin that are sugar-free. So that's or a little gummy bear, or kind of gummy kind of things, and they can be sort of like a treat, but you're actually healing the gut lining. Even getting back to using slow cookers and meat that have a lot more of the collagen and connective tissue, just because the collagen is healing the gut lining. Another simple thing is apple cider vinegar with every meal. So what that's going to help to do is it's going to strengthen the digestion and breaking down the food in the stomach, but it also helps acidify the small intestine. And we need to have the small intestine be a bit acidic so that the bacteria from the large bowel don't migrate up to the small bowels, the small intestines. So apple cider vinegar or betaine hydrochloride is a really good thing. I'll just take a drink.
You're good.
So, healing herbs for healing the gut lining, cyprium elm, peppermint and ginger. Fermented foods. These can be good, but you've got to, for people that have got anxiety and gut issues, they need to be a tiny bit careful of fermented foods, because not everybody is going to react the same way. So some people do really well on fermented foods and probiotics, and other people, it flares up their system really, can give them more bloating and gas and things like that. So if you do have that side effect of fermented foods and probiotics, what I'd suggest is maybe going for Saccharomyces boulardii, which I call it a probiotic like yeast, so that people can kind of understand what it's there for. So it is a yeast, but it's a healthy and a good yeast that helps crowd out any bad bacteria. and low histamine and low lactate type probiotics are also really good for anxiety as well. So because there are some probiotics that will release more histamine or release lactate, and these are chemicals that can increase anxiety. And two other diets that can be very helpful for healing the gut, the Fodmap diet. Have you heard about that one, Lacey, before?
Yes, I have. I use it a lot.
Yeah. And for anyone so if you've got depression or anxiety or brain fog or fatigue, if you've got gut issues along with those symptoms, then, bloating or reflux or constipation or diarrhea or digestive pain, I think just trialing the Fodmap diet for a month is a great idea, because I've seen people within 3 days just have their brain fog just lift and just have clarity of thought, and their anxiety resolve and decrease. So that would be the first diet, because I think it's not too restrictive. You have to learn what you can eat and what you can't eat, and then you can try reintroducing some of the different FODMAPs. But another diet that's very helpful at healing the gut lining is the GAPS diet, but is a lot more restrictive. It's around broths and things like that. But and finally, I'd say consider going to see an integrative medical doctor that tests for parasites and the levels of good and bad bacteria as well.
Yeah, that's a very important point. For me, I like to always figure out what is the gut issue that is going on. So whether it be low stomach acid, high stomach acid, small intestinal bacterial overgrowth, lack of digestive enzymes, poor gallbladder function. So all about figuring out what's going on. That way we can restrict as little as possible. That's what I'm all about. Restricting as little as possible, helping people to live out their lives. So I think apple cider vinegar is one of the first things that I normally suggest, because it acts like hydrochloric acid in the stomach and can really help some people digest their foods. But of course, that's not going to help somebody who has SIBO, because they have an overgrowth.
Right. Yeah. Yeah. Okay. You don't think so?
I think it could, but if somebody has an overgrowth, they're going to need more than the apple cider vinegar.
Oh, yes, but it can be one of the things that are going to be helpful. Yeah, I think sometimes for me, with the Fodmap diet, I'm like, just give it a shot, because sometimes what I try to do is get people the greatest gains in the shortest amount of times with the least amount of effort, and and with the Fodmap diet, it's not something you want to be on long term, and it's not the be all and end all. But if it clears up your mind and your thinking and your mood, then you can have a lot more motivation and attention and energy to put into actually healing the gut as well.
I love that. Okay, so my next question is, what is the preferred method of testing that you use in clinic to help someone struggling with anxiety?
Okay, so this is going to be case to case, really, because it depends on the finances of an individual, of the client, and the motivation of the client as well. And as I said, I usually start with basics screening, blood tests and things through the doctor. So, sometimes I've picked up a celiac disease that hadn't been picked up. So had a client that had anxiety from childhood, but she'd also had diarrhea since childhood.
Oh, wow.
And everyone thought that the diarrhea was because of the anxiety. And no one thought, maybe the diarrhea is a symptom of celiac or a gut issue. Let's treat the gut issue to see if the anxiety will resolve. So I've picked these basic things. Sometimes you can turn someone's life around if you pick up low thyroid, if you pick up vitamin B12 or zinc or vitamin D deficiency, just by treating these deficiencies, for a small amount of people, that'll just be life-changing.
Yeah, hands down, you have to go about the testing.
Yeah, I think so. Yeah, you can't can't guess it all. Also, I like the Dutch hormone complete test for hormones and adrenal function. I also like the oligoscan, which I told you about. So it's it's a spectrometer. So that is a well-known technology to look at minerals and heavy metals. But the novel thing about it is that you do it on the skin of the hand rather than the blood, and you can do it in clinic right on the spot. So love that. But probably the test that I love the most would be the organic acid test by Genova, which it's awesome because it looks at, energy levels, so the mitochondrial function. It looks at blood sugar imbalances. It gives you an indication of fatty acid metabolism, so that can give you an idea about gallbladder as well if people are absorbing their fats. It looks at B vitamin deficiencies. It looks at dopamine and noradrenaline and serotonin and brain inflammation, detox, and gut dysbiosis as well. So that one, I would say, if people can only do one test, then that's value for money. So, but also I just wanted to say for anyone listening that even just asking good questions can guide you in the right direction. So if you've got the gut issues, okay, let's look at gut health, look at celiac, look at SIBO. And little things like white dots in the fingernails can give an indication of zinc deficiency. Muscle cramps and twitches and things like that can give you an indication of a magnesium deficiency. So on my website, I have a symptom checklist, and it's got over 30 different symptoms and a couple of questions about people's diets. And so a person can fill it in, and it gives them an indication of where they might like to look at. So they might, and it's got information there about low thyroid and B12 and pyroluria, the one with the zinc deficiency. So it's got some symptoms there. So that's a really good place to start. That's free and accessible, and yeah.
Awesome. So you guys, I will make sure that everything in regards to that website, her social media, her YouTube, all those links are in the description below. That way you can just copy, paste it, put it in your browser, and go to it. But my last question for you is, what are your key supplement recommendations for somebody who has anxiety and then depression?
Okay. Well, for anxiety, I'd say start with magnesium, because it's a very common deficiency and it's very safe and very effective. So magnesium, probably 200 to 400 milligrams a day. The magnesium glycinate is a very calming form of magnesium, so I like that. It's a little bit harder to get your hands on, but seek that one out. As I said before, zinc, if anxiety runs in the family or other mental health conditions run in the family, I would check out your zinc levels. And if there's any gut issues, I'd look into the Fodmap Diet. So there's 3 simple, safe things that people can do. With depression, I would start with omega-3, especially if you have, you don't like fish or you have a history of not eating it. Just supplement omega-3. People need to be really careful about how much they're taking. Not that they're taking too much, but usually people are taking not enough and not of the right form of omega-3. So the active omega-3s are the EPA and DHA. And although DHA has the highest concentration in the brain, it's actually not the most helpful for depression. It's the EPA, which is anti-inflammatory properties. So people need to make sure that they're taking an omega-3 with more of the EPA in it than the DHA. And I've got a video on that as well. But in the range of 1,000 to 2,000 milligrams of EPA a day, and in the lower range, so 500 to 700 of milligrams of DHA per day. The other one I'd say for depression would be B vitamins with folate. and ideally methylfolate, not folic acid. And the B vitamins are very helpful for mood and for energy levels. Something we haven't talked about is in America, it's not the case here, but in America there's a nutrient, it's a medication, is methylfolate, and they actually use it as an antidepressant, but it's actually an active form of folate in the body, so that has real great antidepressant properties for the right people. And zinc, again, if it runs in the family, I just really, really love zinc. It's so simple, it's so cheap, it's really, really effective, and I think it's something that a lot of people don't know about. Yeah.
I love zinc, and the power of zinc for workout recovery and immunity, so not getting sick, is also phenomenal. I take zinc every single night. I take a zinc, ZMA, zinc, magnesium, and B6 every single night, and I swear that has helped me. Cross my fingers I don't get sick now, but that has helped me in regards to my immunity and my recovery.
It's great for stress management. That's just for myself, is zinc every day. But high doses, because I think with mental health you need those high doses for it to really work.
Yeah. Now, what are your thoughts on adaptogens? Are you a fan of them? Or you go through?
Yeah, well, I think, I mean, I love, I think the adrenals are very, very important. So, it's one of those things that's really hard to give a one-size-fits-all recommendation. And, some people, happy to take 6 or 10 supplements, but trying to find what makes the difference for you. So definitely with anxiety and depression, adaptogens and adrenal support supplements are wonderful.
If any of my listeners want to learn more about the adaptogens, I did discuss them in my podcast with Sam Miller, so make sure you go back and you listen to that one. But I just want to thank you so much for your time today, Dr. Janelle. It's been such a pleasure to have you on. You have gone into detail on all my questions, and I just want to thank you so much for that. If you can tell my listeners where they can find you, follow you, and access your free resources, that would be fantastic. I'll make sure everything is in the description below. That way they can just click right to it.
Okay, great. Well, it's drjanellesinclair.com. That's my website, and on Instagram and Facebook and YouTube, I'm under Dr. Janelle Sinclair, which is just a DR for doctor. So, you can find me quite easily. Yeah, they're all consistent and all the same. So it might be a little bit long, but it's easy to find.
Nah, that's easy. They'll find it.
Good.
Plus, I'll link it. They'll be good. Alrighty. Well, thank you so much for your time. I apologize if you saw this animal down here. My cat decided to start talking to you during this podcast, but thank you so much again. And I hope you have such a fabulous rest of your day.